plagued by an extremely high percentage of surgical site infections, the Riverside County Regional Medical Center developed and implemented an educational plan that drastically reduced this rate.
Our hospital is a county hospital, more than 400 beds, and probably the busiest emergency department in our county, where we're seeing more than 100,000 patients per year. Okay. And within our facility, we perform around 10,000 surgeries per year. We decided to participate actually it was a non-mandated initiative that was put out by the American College of Surgeons, which is called the NSQIT program, National Surgical Quality Improvement Project. And one of the things that caught our attention is the report in 2008 showing how are we comparing to other hospitals on surgical site infections. So they were not only tabulating how many infections we had, but from each hospital that participates also what were the medical problems, or how serious that patient was. Our infection rate was 2.5, and we found ourselves to be the worst hospital among the 200 that were participating on this. So that really caught us by surprise in a way, because we as surgeons felt, oh, we're doing really well. We're not having so many infections, but until you start measuring, then that comes to your attention. At that time, we started, like many hospitals in the country, to actively participate in an initiative that was called SCIP, Surgical Care Improvement Project. But at the same time, we started to participate on the CDC initiative for surgical site infections. Even though it was not mandatory at that time, we were reporting 27 operations, and the difference was that the CDC is requiring information from 100% of those cases. The American College was just doing a sampling of that. So in the year 2009, when we were thinking, oh, we're doing better, from the CDC we're almost 2.7. So we were having double number of infections than the CDC would consider for us as expected. So at that time we thought, well, we need to do something that goes way beyond what the CMS and the Joint Commission are requiring.
In 2011, the medical center formed a team of surgeons, anesthesiologists, OR nurses, infection preventionists, and housekeeping personnel to wage a campaign against surgical site infections.
Looking around, for many of other hospital-acquired infections, like infections from urinary catheters or central lines, there were bundles that were kind of agreed by different organizations. We did not find any bundle for surgical site infections, so we kind of came up with our own bundle that added, a lot of additional elements, and that was starting to create a cultural change among the personnel and the patients.
All the patients that come to surgery, they do a chlorhexidine wipe prior. That's given to them in the pre-op holding area to wipe the area where the surgery is going to be. We've also implemented antibiotic prophylaxis for the patients. We have changed our way of our surgical attire by wearing long sleeves throughout the OR because of the skin shedding, and that could create surgical site infection.
The team developed an education plan for both patients and caregivers about preoperative measures that must be taken to prevent infection.
One of the major changes that we brought was to shower with a disinfectant soap for 3 days before they will come to the surgery. So we started to educate the patients and also provide the soaps for them, and really have the surgeons talk to them and explain to them the importance that will be for 3 days before surgery to doing that. We would start really asking the patients before doing the case, did you really do that? And if they did not do it, then we would have nursing staff do it even before the patient will even come into the operating room. And there are multiple studies showing that By doing that, you decrease the bacterial load in the skin, and it's not just the prep that is done inside the operating room that could partially, help, but this was a major change.
Between 2010 and 2012, the infection rate at the hospital plummeted by more than 75%. This substantial reduction has resulted in improved patient care, heightened patient safety, and a reduction in medical care costs.
Between the year 2010 and 2012, we saved close to $1 million in additional cost. And for an institution like ours, where a lot of our patients are underserved and do not have an insurance that pays for all that extra cost, it all comes from the taxpayers and the money that we get to take care of those patients.
So I think that everybody's on board and is always looking at ways to prevent surgical site infections and how to better the way that we do things.